Hello, my name is Courtney Spees, and I'm doing the tuberculosis case study. So the first thing that I do is walk into the room, introduce myself. Hi, my name is Courtney. I'll be your nurse today. I'm going to go ahead and look at her body position. I'm going to go ahead and look how many side rails she has up. If she has any tubes, drains, oxygen, anything like that. I'm going to also make sure that she has her collar in reach and her bed is in the lowest position and the wheels are locked. I'm also going to look to see if she has any obstacles at her bedside or in the bathroom. And then I'd also make sure that her whiteboard is updated with the correct names and date. I'm also looking, did I say already tubes and drains? IVs, colostomy, anything like that, Foley, catheter, anything like that. So the first thing I'm going to do is introduce myself. Hi, my name's Courtney. Are you Mrs. Bull? And then I'd go ahead and use two patient identifiers. I'd ask her name and birthday, and then I'd also check her wristband for the correct name and birth date as well before I start my assessment. So I'm going to go ahead and start my assessment now. Mrs. Bull, can you tell me your name and birth date? Can you tell me where you are? Can you tell me what today's date is? And can you state the president? Alrighty. So she did all that correctly. The first thing I'm going to do is go ahead and ask her to turn her head to the side. No JVD. No JVD. The next thing I'm going to do is do a neuro. So I have my pen light. 4 millimeters equal round reactive. I'm also going to go ahead and look at her skin. So it states that she is experiencing chills. And so she's kind of clammy and pale. So I'm going to say that she's diaphoretic, that her skin is warm, clammy, and pale. I'm also going to go ahead and note if she has any edema, if she has any paresthesia, pain, anything like that, which she has 2+ pitting edema on bilaterally on all 4 extremities. So I'm going to go ahead and feel for her pulses here. Okay, and then I'm going to have her push me and pull me. And then I'm also going to have her wiggle her fingers, and I'm going to do cap refill on each single finger, which was less than 3 seconds. Okay, so now I'm going to do a focus assessment and do her respiratory assessment. So I'm going to ask you if you can sit up for me. Well, thank you. All right. So have you had a cough or anything lately? You have? All right. Is that cough productive? It is. Okay, blood comes out. All right. Can you tell me how much comes out? Alrighty. I'm going to go ahead and turn her around. Okay, I'm going to do your, whoop, don't fall over. Don't want that paperwork. Alrighty, so I noted rhonchi in the upper lobe, and I also I'm going to listen to her apical pulse. So S1 and S2 sounds are present. The next thing I'm going to do is inspect her abdomen. I'm looking for any bruising, cuts, anything like that. Okay, so have you been able to pass flatulence lately? And when was your last bowel movement? Do you have any pain? Okay, so I inspect it. I'm going to go ahead and palpate. Alright, nothing feels weird. And I'm going to go ahead and auscultate. So bowel sounds are active in all 4 quadrants. The next thing that I ask you is, have you had any discharge or any pain while urinating? No? Okay, so then I'm going to go ahead and move down to her lower portion. Well, you can't even see me. How about that? Well, you still can't see me. Whatever. You can look at me. Okay, so I'm going to go ahead and inspect her lower extremities. I'm noting that they are also pale, anesthetic. I'm going to note if she has any edema, which she still has the 2+, and it's pitting. And then I'm going to also look and see if she can do the push-pull. I'm going to feel for her pulses. I'm going to look for any paresthesia, pain, paralysis, anything like that. Wiggle your toes for me. All right, I'm going to do cap refill on both legs. I'm also going to ask if she has any pain or anything like that. And then if I was able to, I would like to get her up and walk, but she's laying down, so we'll just leave it at that. So the next thing I'm going to do after I do that assessment is I'm going to go ahead and explain to her that I'm going to give her a tuberculin shot, which that is just used to test if you have tuberculosis, since you did say that you're having respiratory problems, that you've been out of the country and everything like that. So the doctor ordered that for us. So I'm going to make sure that I have the correct drug, the correct patient, the correct dose, the correct time. And then later on, right now I'm going to make sure I also have the correct reason. And then after I administer this, I'm going to ensure that I have the correct response from the patient that I want. So I'm going to grab my 1 milliliter syringe. And I would have gloves on while I'm doing this. I'm going to have my 1 milliliter syringe with me. I'm going to gather the medication that I'm drawing up, some alcohol prep pads, and some gloves. I'd wash my hands. I'm going to go ahead and check the order. I'm also going to verify her allergies. I'm also going to ask her if she's ever gotten a TB test before, and explain to her that we'll read it later on in the week, and depending on her test results, that will determine whether or not she has tuberculosis or not. And I already explained the reason why we're testing her. So the first thing I'm going to do is read the order. So I'll be giving her where is your order? Where is your order? Yeah, just says, so I'm just going to draw up my medications. So I'm going to wash my hands, put my gloves on. I'm going to draw up air. Drawing up air. I'm going to safely instill the air. Draw up the medication. Making sure I'm trying to avoid any air bubbles. Alright, so now I'm going to recap my needle safely by the scooping method. Scooping. And then the next thing I'm going to do is grab my alcohol prep pads. I'm going to inspect her skin. We're going to be giving this on her left forearm. So I'm inspecting her skin first, looking at everything. I'm wearing gloves, by the way. I'm going to grab my alcohol prep pad and alcohol her skin. I'm going to, also before I do this, I'm going to ensure that I have proper consent from the patient to perform the test. So I have gloves on. I'm going to safely uncap the needle. I'm going to take my needle and do about 5 to 15 degrees right into the skin. And epidermis. I'm going to inject. I'm going to ensure why I'm injecting. I'm doing it slowly, and that I'm making sure that I'm seeing the little well pop up. You don't want to not see the well, or you don't want the medication to leak out, because then you won't be able to properly tell or not what the results from the test were. Then I'm going to safely recap my needle, which in the hospital setting I would just dispose it. Alrighty. So, what we're wanting from you is anything less than a 10 millimeter response is technically a negative. When we were to record the results, we wouldn't say negative or positive. We would put the millimeters, and then that would determine. It might itch. It might sting a little. Try not to touch it or like run over it or anything like that. I'm going to go ahead and sometimes you can place a Band-Aid over it, but I mean, since she'll be staying here, she won't need a Band-Aid. So yeah, that's basically that. Okay, and so then after I did that, I'd also ask her how she responded to it. So like, if she had any pain, stinging, any allergic reactions, anything like that. And then obviously she'd come back and then we would read the results. So hers was positive. So then now we have in order to give 600 milligrams of rifampin. So I'll be preparing that. So once again, I'll be making sure that I read the order, that I have consent from the patient, and then I'm checking that I have the right drug, the right patient, the right dose, the right time, the right reason, and then also afterwards that I have the correct response that I'm wanting. I'm going to ask her allergies, and just like when I did the TB test, I'll also be doing 2 patient identifiers, so asking her name and birthday, and then checking her ID band or checking her ID band to the chart. I'm also going to ensure that I ask her if she's had this before, and if she has, how she reacted to it. I'm going to explain that this is going to help treat her TB. I'm also going to warn her that some possible side effects are abdominal pain, diarrhea, heartburn, nausea, and vomiting, and that her saliva, sputum, urine, stool, etc. may become orange. So that's a pretty good thing to tell them. This medication may cause drowsiness. You want to avoid drinking any alcohol in this medication. You want to report if you have any flu-like symptoms. And then with drowsiness, obviously, you would also want to make sure that you are maintaining, like, no rugs, no fall hazards, anything, just in case you are drowsy, you walk around, we don't want you to fall. So the first thing that I do is, like I said, do her patient identifiers. I'm checking the order. I'm going to wash my hands, get the little med cup, get the med itself. I'm going to scan, and then I'd go ahead and make sure that I read the label, ensuring, like, so if it was like 300 milligram tabs or whatever, just making sure that I have the correct dosage throughout the entire process. So I'm going to go ahead and do this, and I have a cup of water and her medication. Can I just give you your meds and you take it that way, or do you need it in applesauce or pudding or something? No? Okay, so she said that she just wants it with water. So I'm going to go ahead and administer that to her and give her the water, and then I'm going to watch her take it and then ensure that she took everything. It also states that you would want to give this on an empty stomach with a full glass of water an hour to 2 hours before any meals. So then afterwards, I would come back after I administer this medication and making sure that she's not having any of the undesirable side effects, how she's responding to it, so I can go ahead and chart that. Just like with the TB test, I would go ahead and chart, I never said what I'd chart. For the TB test, I would chart how much I gave, what syringe I used, where the location that I gave it, and then if she had any, like, responses. And then I'd also document that I did patient education. and the same thing for this medication. I would chart when I gave it, which route I gave it, so I gave it orally, how much I gave of the medication, if she had any reactions to it, when if she had any previous use with the drug, which she's never taken this before, and then I also document patient education as well. So I guess that just leaves report off. So we have, let me get my papers and check. We have Mrs. Bull. She's a 39-year-old female. She came in complaining of a cough for the last 3 months, and she was experiencing chills and night sweats. She was also coughing up blood. She had rhonchi in the right upper lobe. She had normal S1 and S2. She had 2+ peripheral pulses in all 4 extremities. She was very diaphoretic. She had traveled to South America recently. She said she's been feeling more fatigued. And she had an unintentional weight loss of 20 pounds. We went ahead and ordered a chest x-ray, a TB test, a sputum culture, a blood culture. We went ahead and also gave her rifampin, or we did a TB test. It came back positive. We gave her rifampin after that. She's in isolation now. She's in a negative pressure room. She's tolerating her RIPE therapy very well, and she's starting to have diminished symptoms, so no more cough or anything like that. She is going to go ahead and be discharged today with the rest of her medication. So we're just going to make sure that we reiterate the patient education on the medications, that she doesn't need to be taking, or she needs to take them until they're completely finished, and that if she does stop taking them, then she can have a resistance to them in the future. So if she would get TB again in the future, then she would no longer be able to take these medications. So yeah, that's about it. So thanks for watching.